Welcome to the Executive Masters in Clinical Quality, Safety, and Leadership information session. We're bringing this session to you to give you a little bit more information on our program as you seek to make decisions about your own higher education. When you think about patient safety is a fundamental part of healthcare. It's, a common goal of all health science professionals. It means focusing on identifying, preventing, and alleviating adverse outcomes or injuries caused by the process of patient care. And it's just a commitment to providing the highest quality safety care possible. So why is that important? So how is safety impacting us as healthcare professionals and as consumers? Because remember, you and I are both consumers of healthcare. You may not be right now, but at some point in our life, we will all be consumers of healthcare. So let's take a look at the risk stratification table created that compares healthcare to other high-risk industries. Now, if you look here, your chance of dying while bungee jumping is 1 in 500,000. I don't like to think about this being safer than my patients being admitted to the hospital. But if you start to cross-compare, 1 out of every 616 patients will suffer an adverse event while experiencing care in our healthcare facilities. And if we look at this issue from a national perspective, we see that it's the third leading cause of death in the United States. That's 700 people a day, estimated over 200,000 a year, conservatively. So just again, we're being conservative with that number. And another way to quantify this is 2 fully loaded 747 airliners crashing every day, or a third of the population of Baltimore. So why is this acceptable? If 2 fully loaded 747s crashed every day, it'd be all over the news. It'd be on the cover of every magazine. It'd be in everybody's social media feeds. People would take to the streets demanding answers and demanding change, and that we start addressing the issue. And more importantly, they'd stop flying, right? So I'm not sharing this data with you to scare you. I'm sharing it with you to bring attention and urgency to the matter. It's also very important that I share with you causes, because I most certainly don't want you to think that we have a bunch of unskilled healthcare professionals providing care for us, because that couldn't be further from the truth. So let's quickly expel some myths related to errors and talk about the reality of being human. And so what are some common myths around why we make mistakes? If I asked all of you, I'm certain that you'd come up with the top 3 answers that I always get, and that's only careless people make mistakes, only incompetent people make mistakes, and lastly, inexperienced people make the majority of mistakes. And I'm here to tell you that everyone makes mistakes. Everybody makes mistakes, and on average, we make between 1 and 20 mistakes a day. And those that work in healthcare environments work in really high-risk situations. And working in these high-risk situations means that there's a higher likelihood that we would make a mistake. But I'm here to let you know that errors can be reduced by practicing low-risk behaviors and understanding the system safety or the safety science behind practicing safe behaviors in healthcare. So to start talking about how we can do some of the work that we do, we have to understand that there's 3 behaviors associated with errors. There's normal human errors, at-risk behaviors, and reckless behaviors. So let's use a traffic scenario to put these into perspective so you can kind of understand where you fall on that spectrum. So normal human errors, a slip, lapse, or mistake. Imagine that you're driving in your car and you're in an unfamiliar area. And you're driving, you're not familiar with the roads, you have no idea where you're going, and you go past the stop sign, you fail to stop. Why? Because you didn't see it. It was a mistake. You had no intention of actually running that stop sign. It was because you made a normal human error. It was a mistake. Now, at-risk behavior, also known as pushing the limits, is something that we all are guilty of. I would say most of us are guilty of. And if we go back to our same, traffic example, think about how often you get in your car and you drive the same routes You know that the speed limit might be 35 miles per hour, but I think it's pretty safe to say that we all push the limits and we feel comfortable maybe driving 40 or 45 miles per hour, or you're on the highway and the speed limit's 55, but we do 65 or 70. Now, we know that we're pushing the limits, but we have more familiarity with the road, with our car. We've been on the route before, so we feel safe in pushing the limits, but we still know that it's an at-risk behavior because we're very well aware of the rules and the laws associated with driving on that highway or on whatever road we're on. Now, when you start to think about reckless behavior, I'm going to bring in a different example. Imagine that you've had one too many drinks and you've actually made your way to your car and you've made a decision that you're going to drive. You know that it's a bad decision because you know that you shouldn't drink and drive. You know that you're probably a little bit more impaired than you would be normally. And so despite you knowing in the gut of your stomach, the feeling that you're getting that you're doing something wrong, you decide to drive anyway. So at this point, it's a complete conscious disregard for rules or processes. You know that you're taking a risk, and it's a high risk at the expense of whoever you may come in contact as a result or be in a car accident with. So when you start to think about these three behaviors, one of the things that I really want to share with you is when you think about normal and at-risk behaviors is that there's a way to actually manage through some of those. There's safety science that we could apply to those that can get us to safer conditions. We can't eliminate errors. That's not the goal here. The goals are always to reduce the harm that comes to the patient when we think about safety science and patient safety. So we have to start thinking differently to view safety science and risk through the lens of safety science. And that's what our program is intended to do. And we demonstrate how you're able to do that. So just at a high level program description, the Executive Masters in Clinical Quality Safety Leadership Program is a 16-month program, and that's 32 credits in total. Now, one of the greatest things about our program is that it's completely online and it's an asynchronous program. It covers 8 courses, which includes a longitudinal capstone that you'll start tipping into or experiencing or entering at the close of every course. Now, we do offer it full and part-time, and the only time that we're actually coming together in a synchronous setting is for the 3-day onsite, which takes place during the 5th course, 505. The overall cost of the program is $49,600. Now, if the Executive Masters is not for you and you're looking for something a little bit more short term, but looking to have some experiences in patient safety or leadership, we do offer 2 executive certificates. Both certificates equates to 12 credits, which is 3 courses. Now, with the certificates, there's no capstone requirement. It is a full-time option. This is, again, fully online, asynchronous, and the cost of the certificate is $18,600. If you're looking at the sequential order of the Executive Masters, it starts out with Introduction to Patient Safety and starts to really lay the foundation for all the patient safety and quality work that have gotten us to where we are. Next goes into 502, which is Safety Science, Risk, and Mitigation, followed by Quality Improvement Methods. You'll go into Effective Leadership in Healthcare Organizations after that, and then we'll segue into Interprofessional Experiences where you will come for the on-site and experience some simulation. 506 is Policy, Regulation, and Economics. And lastly, we have 507, Creating and Leading Sustainable Change. So really putting everything together and driving those performance improvement, making sure that we include all of the safety and quality metrics and utilizing leadership skills to drive those changes. This is a high-level overview of what the certificates look like, and I want to give you a little bit more background information on a certificate if that's something that you're interested in. Now, the Patient Safety and Quality Certificate, again, is 3 courses, 12 credits, and the greatest thing about this is that it's offered in the fall and the spring as well. And what you get for quality and safety is 501, 502, and 503. And again, you're taking 1 course at a time, 12 overall credits. Everything is online. The difference with this certificate versus the healthcare safety and leadership is that this really focuses on quality improvement methods. And one of the benefits of our program, if you compare us to other like programs, is that we have a partnership with NACU. So during 503, you're going to get exposed to all of the coursework that you would normally pay for by taking a NACU course to sit for your CPHQ examination. All of that training is built into our quality improvement methods course. So you will get exposed to all of that. And actually, upon completion, you will be ready to sit for the CPHQ examination. So it's a win-win. Not only would you be receiving the NACU certification study, but you'll also be receiving an executive master's through Georgetown. So this is a benefit that a lot of our students like. If you're more interested in healthcare safety and leadership certificate, this is something that we also offer. Again, this is 3 courses, 12 credits. It is essentially 1 semester worth of education. The difference here is that instead of taking the quality improvement methods, you're going to go into the effective leadership and healthcare in lieu of that. And the difference here is that we're going to expose you to historical management around leadership, modern leadership, organizational leadership, how to evaluate the environment, make decisions as a leader, and really talk about ethical responsibilities and mindfulness as it relates to your leadership, your own personal leadership style. If you look at our currently enrolled students, I'd like to give everybody a background so that way you can start to make decisions if this program really is for you. And we are very diverse in our student enrollment. And in fact, we have students that are researchers that are currently enrolled, active military members, actually nurses, physicians, patient advocates, med malpractice insurers. And lastly, we do have teachers that are enrolled in our program as well that are really interested in learning more about the healthcare environment, thinking about different career paths for themselves. Students that have successfully completed the program and the certificate, some common pathways for them are into the role of the patient safety officer. They're doing a lot of healthcare consulting, specifically as it relates to safety and quality. Directors of quality and safety, chief safety officers, directors of high reliability, risk managers, and lastly, patient safety advocates. So you can see very diverse and different pathways that they're taking as well. So I'll leave you with the saying, don't be afraid to make mistakes, be afraid of not learning from the mistakes. And that's one of the core components that we teach in this program as well. If you have any questions, please feel free to reach out to Jackie Stark or myself, Crystal Morales. Jackie can be found at jts117@georgetown.edu. And I can be contacted at cm1669@georgetown.edu. If you have any questions, please don't hesitate to reach out. Good luck in your educational journeys.